My name is Deborah Patterson. I'm head of media relations for the University of School of Medicine. Thank you all for coming.
Good afternoon. I'm Dr. David Stewart, Chair of Family and Community Medicine here at the University of School of Medicine. And I'm going to be the moderator for that. I'd like to welcome everyone and thank you for coming to learn about the new Kahlert Institute for Addiction Medicine. In the audience today, we have faculty, staff, members of various boards, politicians, distinguished residents of Maryland communities, and members of the media. Welcome to all of you. We all know how members of the community struggle with substance abuse, which is indeed an epidemic in our country. All states, including Maryland, struggle with addressing addiction and its impact on an individual's physical and mental health, the ability of a family to function, and society's legal and healthcare systems. Thus, the need for an institute such as the Kahlert Institute. Our first speaker about the Kahlert Institute is Dr. Bruce Taylor, the president of the University of Maryland at Baltimore. We would like to thank Bruce for his leadership allowing the campus to be highly engaged with communities in Baltimore as well as throughout the world.
Thank you, Dr. Stewart. It's a pleasure for me to welcome you here. I see many familiar faces in this crowd. I see others that I don't know, so welcome to you. Welcome to the University of Maryland, Baltimore. I think as Dr. Stewart has said, this problem touches many, many families, if not all, in the state of Maryland. It's an important factor to pay attention to. And in my tour of Carolina County several years ago, Dr. Weintraub Bergen, the facility in that county, and the ability to deliver care remotely to citizens in that area of the state. And I know that this is one example of other examples where people are reaching out to try to help this very much addicted community get better. It's a difficult disease to prevent. As we reach the time when we do prevent it, it's a difficult disease to treat, and of course there are many other issues around the treatment. This gift from the Kahlert Foundation, which we will hear more about in a minute, ends up being the guidance for us to form this center, Institute, I think we call it, for addiction medicine. It's really important because, we have a lot of depth on this campus from things that touch addiction medicine, yet we don't have a center. So this allows us to create that center and to shine a very bright light on all aspects of addiction and the basic science, the clinical care, the prevention, understanding all the things we know about it. So I want to thank the Kahlert Family and the Foundation for being here and for supporting this. Thank you. And I certainly want to thank Dr. Mark Radley, who has helped put this together. And I especially want to acknowledge the government who is here to help us open this institute. It's wonderful to be here as well. So thank you for that. I look forward to great things from this institute and hope to see all of it as well. So thank you for being here today. Thank you.
Can people hear? Good. Okay. I'd now like to introduce Dr. Mark Blattman, Dean of the University of Maryland School of Medicine and Vice President for Medical Affairs at UMD. Dr. Blattman has a tremendous vision for the School of Medicine as healthcare redefines itself in the post-pandemic era to meet the needs of individuals, populations, and the communities of Maryland. Dr. Blattman.
So there was a study published in Science about 4 years ago, and it looked at addiction demographic. And the result is sobering that the rate of substance use disorder is rising exponentially. And we're unfortunately moving to an epidemic where it's possible that anybody that has any addiction potential could be affected. And it suggests that there's an emergency and that there's a crisis that's affecting all of us, all of our families, our sons, our daughters, our friends, sons and daughters, professionals, and that nobody has been really untouched in the story of this epidemic. So we are absolutely humbled and delighted to have a catalytic gift from Greg Kahlert and his family from the Kahlert Family Foundation, and they're investing $10 million into fundamental basic neuroscience and translational research to try to come up with solutions to this great pandemic. This is being matched by an incredible generous $10 million gift from University of Maryland, Baltimore to renovate the floor above us. There's a held-out floor that's going to be completely renovated over the next few years and built to a state-of-the-art lab. And then support from the School of Medicine, another $5 million will be raising another $5 million. But really looking at this transformative investment to try to bend this deadly curve. Just a few statistics. 20 million people in the U.S. were diagnosed with substance use disorder last year, yet only 10% are receiving therapy. Even though we have therapies that can help prevent overdose while we come up with cures and new therapies. There's more than 100,000 deaths per year of overdose last year. And Maryland is one of the states with the highest rate of overdose. That's more fatalities nationwide than automobile accidents, if I suspect. Now, what we're really excited about is that this gift is going to leverage the strength of this institution. And when I arrived, Sarah Kahlert, Sean, Missouri here, had brought to my attention we needed to do something around addiction. And we did a search of all grants across the School of Medicine and the University of Maryland, Baltimore. There were 40 grants, or 60 grants, over $40 million a year, spread out. So already our scientists were working on this, but not necessarily in a coordinated way. We also have amazing public service in our community, led by Kahlert. We have 6 addiction treatment centers in Baltimore, 1 at the downtown campus here, 1 in UNMC Midtown, 4 on campus on West Pratt Street, in the Addiction Treatment Center, which provides critical methamphetamine and naloxone therapy. Dr. Eric Warrencroft and Dr. Sarah Kahlert just received a major award from the NIH. These are the HEAL Initiative, which is targeted to help end addiction long term, and another called the Prison Award to evaluate the effect of fear-based interventions in polysubstance use and youth and orphan treatment in rural cases with opioid use disorders. So these 2 awards total $23 million over 5 years. So I want to personally thank Greg Kahlert and his family from Kahlert Family Foundation for this transformative gift that's going to bring us all together aligned in a common mission and leverage tremendous grace across the entire University of Maryland medicine system and the state. The Kahlert Foundation has already been a major benefactor to us, going back to 2015. Since then, they've contributed more than $2 million to addiction-related research and basic sciences that includes the development of non-addictive treatments for pain and new treatments for alcoholism and depression, and now this amazing community object. Thank you. This is the largest gift in the School of Medicine in the Family Foundation. So Greg currently serves as the president of the Kahlert Foundation, which was established by his father Joe in 1991. Greg was planning to be a tennis pro, and that career was derailed by taking over the family business. Their family actually developed a company at Apro which is about restoring products. But the success I'm going to see later in the product's life. And he invested a significant amount of return to that company in the Children's Foundation, which is now one of the largest in Maryland, and one of the most generous foundations in Maryland. And they're also investing in programs in Utah with Liz, and we're just so lucky to have your leadership, vision, and this stimulus to move on to greater things. So let's do this with all them great comments. Good afternoon, everybody. Thank you, Jennifer, for those very nice words. This is my first thought. There's a lot of people here today. So I'm glad I brought some notes. Otherwise, I'm afraid I forget what I wanted to say. I guess first of all, I think special note that May is Mental Health Awareness Month. So I think that's the perfect time to kick off this amazing program. So for the Kahlert Foundation, healthcare is one of our largest areas of giving. In the past, we have made some grants of $1 million, that's $5 million. So this is by far the largest grant we've made in this area. More than double the size than previously. And so it just goes to show you our commitment, success, and importance of this program. So why have we made this grant? Two primary reasons. One, is because there's so much substance abuse and addiction. Every week we hear stories, sad stories of young people, adults, and unfortunately, I'd say most everyone that's in this problem is touched by this, either a family member, a friend, or a coworker. So it's just so very special. And number two is just that the University of Maryland is a fantastic partner. They have excellent reputation in the state and region. We have a great history with sports medicine, and the facilities, and the research, and the work, and all their success. So probably the most important reason is people. I'm a firm believer that organizations are only as good as their people. So fortunate to have Dr. Brown has met the team, and that many others today that are also very impressive. And so, again, I think it's all about people, and I know this is a great experience. So we are fully committed, 100%, 110%. Say full speed ahead. And I think then just in closing, I'd like to know that we're really so excited about the opportunity to help so many people in the region, individuals, and the families, and that this is life-changing for all of us. Thank you.
Thank you for those words, Mr. Kahlert. Now I would like Dr. Kahlert to
Lieutenant Governor Linda Miller has been a wonderful addition to the state. The state can decide to work with her on numerous occasions. And she is here now to address you. So,
Good afternoon, everyone. President Durrell, thank you so much for your warm introduction and your incredible leadership here at the University of Maryland, Baltimore. And I can't tell you what an honor it is to be here today amongst so many individuals that are putting their passion, energy, and commitment in trying to address an issue that is facing so many Marylanders, as you already heard from Dr. Gladwin. Those statistics are very much sobering, as you indicated, Dr. Gladwin. And I also want to recognize, despite these sobering statistics, there are so many people here that are making a difference in this effort here. So as you can see, all the individuals that are here. And I also want to give a great big shout out to Greg Kahlert and his entire family for the way in which he contribute to our community. I know that you were mentioned as someone who played a lot of tennis in the past before, but here's a couple of things that I read about you. And one of his favorite mottos is play hard and work hard, right? And I'd like to add one more to that is to serve hard, right? And no pun intended with your tennis skills, but really to serve back to our community. And that's exactly what your family has done. And we are so grateful for your generosity to our entire community in this effort. So thank you very much. And I want to thank all of you who have joined us today on this important matter. Substance use disorder is something that touches all of us. Either we have struggled with it ourselves, or we know a loved one who suffers from addiction, or we know someone who has lost his or her life to this disease. In fact, in my own family, I lost a brother-in-law to opioid addiction. And we know that substance abuse is a chronic condition, chronic disease that can be treated and managed, but it should not be a private struggle. As you heard from Dr. Gladden, only 10% of individuals actually seek treatment. No one should have to suffer in silence with this disease. Our recognition that it is a medical condition, to shift from the idea that addicted people need to be punished to addicted people need to be helped is essential to the treatment, dignity, and survival of those who suffer. The magnitude of this crisis is large, and it's a complex issue, which means that it's going to take all of us working together in partnership to implement solutions that are comprehensive and compassionate. The brand new Kahlert Institute for Addiction Medicine will do exactly that. It will involve physicians and neuroscientists who work together with clinical researchers. It will bring in care providers and substance abuse specialists who understand the daily realities for caring for patients. It will take partners in the state who recognize the urgency of treating substance use and addiction as a priority. The state of Maryland was proud to provide $200 million in funding to help build a health science research facility voted number 3. And in our administration, Governor Moore and I have allocated record funding for mental health and substance abuse programs, including $415 million specifically for substance use disorder services, $27 million dollars increase in over last year's budget. We also appointed a special secretary of opioid response, Emily Keller, to address the opioid and overdose crisis. Governor Moore and I look forward to this public-private partnership and look forward to working together in collaboration, each and every one of you. Thank you.
Now it's a pleasure to introduce Dr. Eric Weintraub. He's the General Associate Director of the Kahlert Institute. He's a professor of psychiatry, director of the Division of Addiction Research and Treatment at the University of Maryland School of Medicine. He's also a darn good psychiatrist, taking care of many patients again. I want to start by thanking everybody here at event today for their incredible generosity in donating $10 million to support the creation of our new Addiction Institute. What an amazing gift. I would also like to recognize Dr. Lieutenant here, and Dr. Olson, and Dr.
Institute, my colleague and friend, to be with us today. And I also want to thank Dr. Gerald for our addiction programs over the years and recognize me gladly for taking the lead and spearheading the effort in establishing this community safety program. I also want to thank and acknowledge Dr. Kahlert, my colleague, who was driving the force and organizing the committee to build a process. As has already been discussed today, we are in the midst of an opioid epidemic that has resulted in the deaths of more than 1 million people in the United States and has profoundly impacted the state of Maryland. The costs of the current addiction epidemic are often quantified in statistics. We talk about the large number of individuals who have died of overdoses, the economic cost to society, and our country's declining lifespan. These figures are important and critical indicators of the devastation we're experiencing as we only tell a part of the story. Over the last 30 years, I've witnessed firsthand the human face of the crisis on a daily basis. Working with West Baltimore and across the state, our teams treated patients with addiction disorders in a variety of locations, including hospital and community settings, emergency departments, and more recently, county jail. We have a saying in medicine that our best teachers are our patients. And throughout the different stages of my career, I found these to be eminently true. I've had the privilege of treating countless number of cases with substance use disorders, individuals that have shared the innermost details of their lives. And I'm now appreciative of learning the lessons from each and every one of them. While every patient has a highly individualized and personal story, certain themes constantly remain. Individuals that misuse drugs on a daily basis face devastating consequences in all areas of their life. They are often estranged from their families and friends, unstable health, have difficulty working, and suffer legal consequences as a result of their use. People with substance disorders are not partying and having fun. They are caught in a devastating cycle that is not great, and they are often isolated, alone, and full of shame. Every day they struggle to survive. Those who are addicted to using drugs are no different than you and me. They have the same hopes and dreams that we do. The desire to have loving relationships, need to work, and be part of a supportive, nurturing community. They want to get better. They are addicted. Addiction is a complex condition that is complicated by a host of factors, including trauma and mental health comorbidities. The treatment must not only be evidence-based and patient-centered, but provided in a supportive, flexible, culturally sensitive environment. Otherwise, patients will not stay in treatment. A one-size-fits-all approach to treatment and recovery does not work. Individuals with substance use disorders can get better when provided with access to appropriate treatment. This is a powerful lesson that drives the work that we do. To see someone with chronic and addiction disorder and going to lead a normal, thriving life is wonderful to observe. Our mission is to develop and implement the vision set forth by the Kahlert Institute with the goal of improving and saving lives in our nation. We plan to do this by forming collaborations across our own schools, among universities' different campuses, with the state and with our community. To do this, we will bring our scientists and clinicians together so we can better understand the underlying mechanisms driving addiction, to develop novel therapeutic treatments, to create innovative clinical programs, to expand access to evidence-based, culturally sensitive care, and to educate our students, clinicians, and the community about addiction. Thank you, Dr. Weinberg. Now I'd like to introduce Dr. Kahlert Institute, Director of the Center for Substance Abuse Treatment at the Federal Substance Abuse and Mental Health Services Administration, better known as SAMHSA. Dr. Olson's career has had a tremendous impact addressing the unmet need for the treatment of addiction
decreasing barriers to treatment for addiction, and improving quality for treatment for individuals with addiction. Before her current position, she was the medical director for the Institutes for Behavioral Resources, better known as REACH Health Services, a comprehensive outpatient substance use disorder treatment program located right here in Baltimore. Dr. Olson.
Good afternoon, everyone. And it is such an incredible pleasure to be here with so many people and so many distinguished individuals. Jeff Bradford and Mary Bradford and Governor, the stewards, Ryan Proud, are very dear and close friends, and just, I think, that part, the generosity that you and your family have shown here is just amazing. I think, from Sam's perspective, being able to participate in events like this is incredibly empowering. The SAMHSA's mission is to lead public health and service delivery efforts to promote mental health, prevent substance misuse, and provide treatments and supports to foster recovery while ensuring equitable access and positive outcomes. And I think there's no more fitting place than here in Baltimore and here at the University of Maryland Medical Systems and the University of Maryland, Baltimore, for a gift like this, and for an institute like this. Personally, I feel like I'm coming home. I trained in general internal medicine and across the street at that other institution. And really saw how over the last 20 years, how this epidemic has also evolved. And how we have not only gone from an epidemic of opioids, of prescription opioids, but Baltimore really as a place where heroin has been the thing that has destroyed so many people's lives, so many communities. And now we recently manufactured fentanyl and xylazine as this complicated, this incredibly consequential crime. So finding those solutions, and we could bring people together to be able to not only prevent, but treat, reduce harm, and upwards provide recovery. Because ultimately, as Dr. Whitehead said, people who use drugs, addiction knows no bounds. It knows no bounds in age, in race, in ethnicity, in setting. I think the fact that this is a medical institution that is really by the hand, because this is a disease. It is a chronic disease. It absolutely belongs in the realm of medicine, the realm of public health, and unfortunately at the moment in the realm of public safety. And so all of these realms and all of these sectors really working together, but leading by medicine, leading by health system, leading by public health in that intersection. They really then we're going to be able to finally wrap our hands around to get a handle on this. I think personally also having worked with so many of the people here over the years in Baltimore, it was just exciting to be able to participate and celebrate this with you all. I often say that it takes a village, and really I think what we see here today, and with the University of Maryland, and with the Kahlert Foundation, and with Maryland, and the administration of Maryland, really is that this is a village coming together. That this is a village that is going to have such incredible impact on the lives of so many people, not only here in Baltimore, but across Maryland. And it is bringing together the expertise and the passion, and the dedication to really make a tremendous difference, not only in the lives of individuals, but their families and communities as well. So I just want to say kudos. Thank you so much for having me as part of this. This is such an incredible alignment with all of the strategic priorities that SAMHSA has, particularly the one related to overdose prevention and reduction. I wish you all the best, and really look forward to the seeing incredible things tonight.
Thank you, Dr. Olson. Now we're going to open for questions. I'd like to invite Dr. Kahlert Institute to come forward to help lead us through
Well, I'll address the first question too. Can you guys hear me okay? Yeah, thank you. We're going to open it up to media, but Dr. Catacuzzi wanted to involve as well. Both Dr. Catacuzzi, Dr. Weintraub, as well as Dr. Keller, all three of them are the associate directors of the Kahlert Institute, and we appreciate all of them for their leadership on this. So, first question, which I have gotten from journalists, is what can the Kahlert Institute do in the immediate future to really help with the solve the problem of addiction?
And first of all, thank you so much. It's so wonderful to see all these faces here today. I will respond to this by saying, if you can look at the pillar behind me, it represents the graphic that what we really underscores our mission. We are laser focused on improving the lives of people with addiction, reducing morbidity and mortality associated with addiction. And we're going to do this through a combination of meeting patients where they are today, but preparing for the future. And we do this through education, where we are increasing the number of providers able to treat substance use disorder, where we're increasing the amount of clinical work that we do, extending our already huge reach across the state. And then for our patients for tomorrow, trying to understand how can we better deliver care through clinical research. And finally, through our fundamental and translational science, how do we develop better treatments? So in the immediate sense, we're going to focus on those patients right in front of us and find out how we can better deliver care to them, overdose prevention and education, but not forgetting our mandate to build a better tomorrow.
Thank you. And I also just wanted to point out as well that we have 3 giveaway bags to Dr. Catacuzzi's point. These include naloxone, over-the-counter spray, as well as drug bags that you can dispose of old medications. These are immediate actions that we can all take now in just to try to save a life as we're waiting for the research as well. Are there any reporters or members of the audience who have questions? Yeah, I will have one other question. I'm a former journalist. Oh, you have so much question?
So in terms of our focus, our focus is kept the verbiage neutral addiction. So it's across substances and it will likely include even behavioral addictions as well. So we do understand that neurobiologically there is a consistent pattern and where we have proven methods and approaches that can be utilized across addiction. So our focus is not just on opioids, although we all know that that's the most precedent. In terms of the clinical research and integration, we as a university have a lot of strength in integration between our clinical care and our clinical research. Myself and Dr. Weintraub are 2 great examples of that as a clinician researcher, scientist, as well as a person who does clinical care, working very closely with Dr. Weintraub and all of the division of addiction research and treatment. We've really integrated understanding how to improve and deliver care right alongside where patients are. So we're able to meet patients in the community at these various treatment locations and have science go right alongside that. Okay. Anyone else? Thanks very much for all your time so far, Sarah. And we have a pending legislation event that we can actually do because legalization of cannabis is being involved in how do you think that that's going to be impacting the position across the state, and how will the Kahlert Institute integrate that into the
Yes, and thank you for that question. It's an important one. For those of you who are not aware, with cannabis legalization in July in the state, I think the most important thing is that we need to understand with real numbers what the scope of cannabis use is going to be and what its impacts are, particularly on our youth population. So that's the science behind the Kahlert Institute, is really trying to understand if there are issues and problems, we need to understand those. If there are benefits, we need to understand those as well, and really round out the body of science around cannabis use. And I would also like to say that I think, it's not just a new thing. Our patients with substance use disorders, polysubstance is very common, and so we have experience in treating cannabis use alongside our other use disorders. So we're prepared to face this as well. Are there any other thoughts on cannabis? Wait, hold on.
Some of the issues that are associated with the I think trying to study it and see how the legalization impacts citizens moving forward.
Thanks, Sarah. So Dr. Gill would want me to point out that we're here on the campus of the future health and legal professionals who will be moving forward forward in our state. And with your message, you're thinking about the future. What is it that each student should know about legalization before they do?
Wonderful question. Thank you. So I think first and foremost, we want every health professional student on campus to be able to recognize addiction, recognize use disorders through this very documented, well-established use disorder criteria. We want them to be able to have appropriate referrals as to their specialty and their capacity. We want them to be able to be first responders, so know how to utilize naloxone in the field for their community and their homes as well as in their places of work. And we want them to look at addiction as a disease, a chronic disease with a relapsing remitting pattern, and to understand how to approach addiction in a non-stigmatizing way. I think that is the strong foundation. The next level is having all providers with the capacity to prescribe medication, be able to treat opioid use disorder, utilizing buprenorphine. Thanks to the work of our colleagues at SAMHSA and others advocating around the country, now all providers with the EPA can prescribe and utilize buprenorphine. And that should be a fundamental part of our curriculum for all of our nurse practitioners, physician assistants, and medical providers. Yes, so I think again, this is one of the additional strengths of the university is, the Center for Substance Use and Pregnancy and your colleagues, that we have a great translational work that's being done already, studying all the way from, animal-based models of exposure all the way to pregnant women and their treatment. So I think this is one of the areas where we already have a great established foothold, and what the Institute can do is help bring everyone who provides care for this population, all of the amazing neuroscientists doing this kind of work, along with information, so we can elevate and really understand where do we take this science and the transition of that field. Absolutely, I'm so glad you brought that up. So
Yeah, the question was, will the Institute try to address prevention? And we believe that is actually in our mission statement. Please don't ask me to quote it right now. But in the mission statement, prevention is absolutely fundamental to the work that we do. And I do believe that education is a critical part of prevention. We need to understand, people need to understand that it's not a disease that is the source of blame, that it can be prevented, it can be treated. But first it needs to come out of their shadows in order for it to, in order for us to stop people from initiating drug use and then it going to a really intense use disorder. So prevention is going to be addressed in our university and in this institute, primarily through education, but prevention programming, addressing again those younger youth is something we discussed. Would you know a little bit more about how businesses plan for improving that education along with the treatment providers is really as well as sharing that with your studies physicians have improved access to healthcare, including primary healthcare. So the second part of your question, I'm actually going to ask Dr. Weintraub to address because we have a really amazing assistant access program. It's going to work, integrate really well with what we're doing at the Kahlert Institute. But regarding what you said about education, our goal is to really make an RTD treatment a fundamental part of the medical school education process. So diagnosis, prevention, and treatment of substance use disorders, so that our students really have the knowledge that they need no matter what specialty they go into. And that's an evolving process that we're going to work very closely with our educator team, with Dr. Parker, and all of the people in the Office of Medical Education to do. And there's already really great work that's being done in terms of naloxone training. But our goal, what we've realized, is that it's not enough to teach someone out of a book. They really need to see people with lived experience of substance use. They need to see patients. They need to understand how the treatment is provided. And as Dr. Weintraub mentioned, many of our students and even residents and even attendants will understand that people can get better and that there's really high rates of people who do well and are able to keep this chronic disease under control. So I think that kind of exposure is going to be integral as well.
We have a program called the It's notable like a restaurant, teachers like the with consultants, so here to last, and program is funded through the state of Maryland Behavioral Health Initiative. And we provide support and training to clinicians around the state of Maryland. Started off with one primary care physician that decided to but it's expanding into young chronic pain, pregnant women, birth reasons, we have a 40-hour lunch call that people can call and get consultation that information. We also provide a lot of webinars and outreach with practices that we want to we also have a primary care integrated care. One of the things that we have learned is that our patients like to get all their treatment in one place. So we actually have an innovative program that we're running down our clinic in West Baltimore. We developed a primary care clinic and a wound care clinic to try to allow our patients with treatment there to get in place with medical and psychiatric care and not able to rely or to keep their services. Many of our patients that we were marginalized
I've been working in the community rural and helping the rural kind of include some non and that's been a really really,
Yeah, absolutely. That's why the view on the steps and the work that he's done before, that's exactly based on this model.
So we have expanded in the last 5 years to treating patients around the state of Maryland. Dr. Welch, my colleague, has been instrumental in some of the telemedicine work that we've done. So we're engaged in 6 to 8 different counties. We developed a neuro treatment unit that Dr. Gerald is speaking about that operates in Carolina County, where we have providers bringing them in to heavy specialists and other treatment providers and units to telemedicine provide medication treatment. We have also working with 6 county jails and trying to provide treatment. I think I'm trying to engage the community because we know that as outsiders from the University of Maryland that we need to work in sexual content in this county. I think we could manage my program and people come around with all this time. I think we probably have not engaged with those communities as well as we could have. So that's something I think is very important, especially that's I agree, probably long-term recovery.
I also just want to add to that from a clinical research perspective, having a trusted connection to the community is essential. And that's what our research, my colleagues are here as well, has really focused on is embedding our research in trusted centers within the community, where people are already accessing care, just like similar to churches, where you have to meet people where they are, as the harm reduction specialist.
uh, move into research that affects policy. I'm thinking we're a campus with a school of law. I'm thinking of the legal problems that people with petition get into and how horrible that is for
Yeah, so one of our pillars is clinical care and policy because we do believe that policy should be driven by evidence. Evidence is created by institutes such as us doing the work of meeting patients, understanding the scope of the issue, and what the implications of different endeavors and interventions are. So we really see that as part of our mission, is to create evidence base so that people like our honorable Lieutenant Governor here can make the decisions that need to happen to improve the lives of people.
the dean has some final comments.
Thank you. So, thank you. I just want to point out that I think what you've seen here is the scale and the complexity of this challenge. We were absolutely thrilled that 3 individuals leading this institute. So Eric Weintraub is a psychiatrist, and is an incredible clinical leader. Really, his whole career, he's devoted to this work. I toured the District Treatment Center in West Baltimore with him. It was just clear his passion and commitment. Sarah Kahlert, who we heard from, is an infectious disease specialist, and she's really focused on the pleiotropic infectious complications by drug use, and people living with complications by disease like HIV and Hep C. And so again, reflecting the complexity of the complications patients face. And then Asaf Keller, the chair of neurobiology, his department has many, many things focused on crime and the fundamental neuroscience. How do you turn off addiction once it occurs? How do you prevent it with new therapeutics? And so this really reflects our commitment with the support of the Kahlert Foundation to link together basic science, translational research, clinical care, and now research policy. So across all these different cases, Godspeed on this incredible scientific effort. We're incredibly confident in your leadership and look forward to great success. I do also want to thank two other people, Ellen Kennedy Myers, where's Ellen? Thank you so much for your commitment to this. And Sarah Bradley, who's our Executive Director of Corporate Relationship. I will say that on the second day of my job, Sarah drove me in an incredible brainstorm, answering all of my questions at the same time, not back in the car, to drive me to a dinner with Ellen and Greg. And so thank you all for making this event happen. Thank you.
Well, thank you all for coming. This concludes our event. Again, we thank the Kahlert Foundation and the family for this wonderful gift to the university. Don't forget there's some giveaways, some things to look at on the tables on the side. And thanks to everyone for coming and have a pleasant evening.